Is your knee stiff, swollen, grinding when you move? Let's pull back the curtain and take a closer look at what is actually going on in there. Because when you understand your anatomy, you can stop blindly following pain and start making smarter choices. I'm Jess. I've been a licensed massage therapist since 2008, a licensed acupuncturist since 2014 with an extensive background in sports medicine and nutrition, and I worked years directly in the OR with orthopedic surgeons as a medical sales rep, guiding total joint surgeries, including hundreds of knee replacements. I have seen firsthand what patients are not being told before and after their surgeries, and I'm here to fill in the gaps. So whether you've already had a knee replacement or you're trying to avoid one, this series is for you. Let's dive in. Your knee isn't just bone. It's a complex hinge joint held together by cartilage, ligaments, fluid, and tissue. Cartilage acts like that slick, shock-absorbing cushion. Synovial fluid keeps everything gliding, and ligaments hold the whole thing in alignment. But when inflammation creeps in, that balance gets disrupted. Over time, inflammation eats away at the cartilage, causing the joint space to narrow. Your bones don't literally rub together like two rocks, but they do come closer due to cartilage thinning. That's when the phrase bone on bone gets tossed around. The body, trying to help, often builds bone spurs, which only adds to the stiffness and pain. It's not sabotage, it's adaptation. But here's the kicker. Knee pain often doesn't start at the knee. Misaligned hips, collapsed arches, weak glutes, stiff ankles, all of these shift how your knees move, load, and respond. Your knee is the middle child in your kinetic chain. It takes the heat from above and below. That's why bracing or injections without movement retraining rarely work long term. What you need is a total system reset. Repatterning your gait, addressing postural imbalances, using therapies like acupuncture and structural integration, and most of all, changing the way you move, not just masking the symptom. Now let's get nerdy for a second. When you bend your knee deeply, like squatting, your femur is supposed to roll backwards over the tibia. This is called rollback. But here's something wild. Your femur condyles are not symmetrical. The medial condyle, the one on the inside, is longer and more curved than the lateral one on the outside. That means your knee isn't just bending, it's subtly rotating and shifting during movement. Most prosthetic knees? Designed symmetrically, unfortunately. So guess what's lost after surgery? Natural rollback, natural glide, natural depth. And that's why you might never feel normal after replacement, because the knee you were born with has a level of elegance and engineering that no man-made joint can fully replicate. The more you understand your anatomy, the more powerful your choices become. It isn't just about fixing a joint. It's about reclaiming ownership of your whole body. Thanks for watching. I hope you found this information valuable. If you did, hit that like and subscribe button. And if you want to go a little bit deeper, head over to my website. I'll leave the link down below. There you'll have full access to my blog series, courses, health coaching, and many more tools to help you feel better, move better, and just take your health back into your own hands. So remember, keep moving, eat something green, and question anything that sounds like a quick fix. Ciao, ciao.